So today it's my distinct pleasure to introduce our speaker, Dr. Sherine Gabriel. She's Executive Vice President for Arizona State University Health, and she is our fourth Creighton Lead Faculty Development Program keynote speaker who's going to talk to us about ASU Health. Welcome, Dr. Gabriel.
So no, I think I'm good, right? You all can hear? Great. I think I'm all set. Clicker in hand. So it's nice to see you. I think see many of you again, and to meet some others. So it's wonderful to be here. My name's Sherine Gabriel. I'm EVP for ASU Health. So as we like to say, let's see here. Oh, it moved earlier. All right, now it's not going forward. I know. What am I doing wrong here? Okay, great. All right. Fundamentally different approach to advancing health at a university, and I'll tell you exactly what I mean by that in the coming slides. And you can see, boy, just for Dr. Litton, I quickly added my email address on there, but I added it in a color that you can't even see. So just as Jessica knows where you can find me. Everything at ASU derives from our charter, which I love and is the reason I and many, many others are at the organization. And the most important thing for health is the last phrase, but I'll draw your attention to the first part of the charter, which speaks to the fact that this is a university that judges itself on whom we include, not who we exclude. So who we include and how they succeed regarding as opposed to who we exclude. And many of the very selective universities, as you've seen, pride themselves on saying, you know, only one of, you know, so many thousand get in here. We try to make our university available to absolutely everybody and sort of meet them where they are and help them advance in whatever career track they're interested in. I love that about ASU, and it sort of resonated a little bit with the mission that I heard Dean Richardson speak of earlier. But also the latter part of the charter speaks to the university taking responsibility for the economic, social, cultural, but also the overall health of the communities where we all live and work. And that's important because, as I'll show you in the next couple of slides, health outcomes in this country and indeed in the state are severely wanting. And so these are data from the Commonwealth Fund, which publishes data on the health of our country every few years. And this is just in 2024. And you can see that when it comes to avoidable deaths, comparing us, the US ball over there, let's see, I think I have like a pointer, but maybe I don't. But you can see where the US is. It's not even on the same slope as the other OECD countries. And similarly, when we look at spending on healthcare, so we spend a whole bunch more than most developed countries in the world, and our outcomes are a lot poorer. That's the bottom line of these data. A little bit closer to home, one of the statistics that I like to share, even though it's kind of a sad one, is this one, which basically says that where you live determines how long you live, not your genetic code, but it's really your zip code. So 20 miles represents about a 14-year difference in life expectancy. And of course, that all speaks to the social determinants of health. So the reason ASU embarked on this journey is because of these data. So it's because we want to see what a large, comprehensive university like ASU can do to move the needle on health outcomes. So everything we do, whether it's the medical school or the public health school or what we're doing in nursing or what we're doing in research or health literacy, as I'll highlight in the next slide, our North Star is health outcomes. So can we show, is there a line of sight between the work that we're trying to do and improving health outcomes at the end of the day? I love this slide because it's the best way of illustrating one of the key differentiators of ASU Health. So it's not just about the med school or the nursing school, but actually every single one of those colleges and schools that you saw scroll past is involved in ASU Health in one way or another. So it could be the business school, or it could be the law school, or could be humanities, and of course the sciences and the health disciplines. So it's a university-wide collaboration, and it's a university-wide priority for ASU. So how are we going to go about doing this? So we're approaching it in four ways. One is creating a new kind of health professional. So I'll show you how we're doing that in medicine, how we're doing that in public health and other fields. Research and innovative solutions for the future. Information. So are there things that we can do to better use, transform, if you will, the information that we're gathering about health in order to improve health outcomes, and then, of course, access. And everything we're doing in ASU Health, indeed, probably everything we're doing, or pretty much everything we're doing at ASU, is powered by innovation, AI technology, and engineering. So we have the largest engineering college in the country. I think something like 30,000 engineering students. It's just enormous. And so it's not just biomedical engineering, it's the whole College of Engineering. We're leaning in pretty heavily into AI as a university. We were the first university to have a relationship with OpenAI, and now we have relationships with almost a dozen AI companies. So yeah, the last one I think is called Cloud or something. But they're just, we're leaning into AI and technology and engineering in a much bigger way. And for those of you who don't know, I have to say that ASU was voted the most innovative university in the country 10 years in a row. I see people nodding. Thank you for remembering that. So it's powered by those things, and it's accelerated through collaborations and partnerships. I've been at a few institutions, like those of you with whom I shared my sort of professional journey know. And I've never been at an institution that leans so heavily into partnerships, collaborations, partnerships. You know, a lot of places talk about buy, build, or partner. For ASU, it's partner, partner, partner. And if you can't figure out how to partner or collaborate, then think about buying or building. So it's real. There's a very low bar to collaborating. Basically, we try to identify people who have shared vision, shared mission, shared interests, and we find a way to work together. So that's all that is to say. If any of this interests any of you, please let me know and we'll find a way to collaborate. At a high level, those balls on the top are the big components of ASU Health. The Health Observatory, the School of Medicine, the School of Public Health, something called the Medical Masters Institute, of course, the College of Nursing, the College of Health Solutions, and then Health Literacy and ASU Health, or ASU Clinics, rather. All of those are undergirded by our partnerships, our innovation zones, and of course, in collaboration with health systems and public health departments. So what do we mean by creating a new kind of health professional? This is going to be the ASU downtown campus, and somebody asked me where the ASU Health downtown campus, where the building is going to be. It's going to be on the corner of Fillmore and 5th, so 480 East Fillmore Street, something like that. It won't look exactly like that, but this is what we have so far from the architect, so it's not terribly far from here. And the first thing I'll talk about is our med school. So School of Medicine and Advanced Medical Engineering. The name will likely change a little bit in the coming months. And there are a number of defining innovations, like everything we're doing, leaning into technology, AI, and that occurs in our clinical training or preclinical training. And the other differentiator is industry exposure. So we want to expose medical students and really other health learners to the industry of medicine and medical innovation much earlier than any of us who went to medical school a while ago were exposed to it. So that's something that's a bit unusual. We like to describe our curriculum as radically interdisciplinary. So yes, we're integrating engineering principles into medicine, but also humanities and a number of other disciplines, entrepreneurship. We're doing a lot in immersive learning. So we're defining avatars that represent different kinds of illnesses and immersive learning experiences that are authentic to the patient experience. A lot of storytelling, kind of leveraging some of the stuff we talked about this morning. Of course, acknowledging socio-ecological factors, especially those common in our area here. And then we're building an EdTech toolkit, which involves things like AI coaches for the medical students and some additional precision tools. So it's a lot of activity and a lot of focus on using AI to educate and also teaching about AI and technology and engineering. This is from the curriculum map, but it just provides the 6 major threads in our curriculum, from health systems, humanities, engineering, obviously clinical skills, foundations, and being a physician. A little bit about our progress to date. So we started this journey, this says October 2023, but we actually started thinking and talking about it seriously at least a year and a half before that. But October 23 is when we submitted our letter of intent for the LCME. And we're now anticipating our site visit on June the 10th. So, pray for us, we'll need it at that time. And if that goes well, we will be heavily recruiting for an opening in the summer of 2026. We have just recruited our founding dean, which was terrific. I don't know if you've met her. A couple of you are nodding, but Dr. Holly Lisenby. Holly came to us from the NIH. She's a psychiatrist. She was in NIMH. Prior to that, she was chair of psychiatry at Duke, and prior to that, she was at Columbia, and she's really hit the ground running. So I'd love to introduce her to you all. And as I mentioned, extensive use of AI and immersive learning technologies. The other new school within ASU Health is the school, we call it the School of Technology for Public Health. So again, leveraging technology in the study of public health. And we're seeing this as maybe even a redefinition of the field. Like the School of Medicine, it's a different approach to studying public health, infusing technology into the training, both in the traditional public health training, but also in the public health service component of the training, and an industry component that also is new. And this gives you an idea of the areas of focus in public health. So from mental health, environmental, women's health, and then some of the cross-cutting disciplines. And again, this is just to hopefully pique your interest if you're interested in any of these, and we're happy to talk a little more about it. The curriculum design features also some novel characteristics. Now, this school launches in 2025. So if you have any interest, or if you know any students who are interested in public health, either an MPH or a master's in public health with a focus in technology, let us know or point them our way. And you can see the robust basic public health training, the transdisciplinarity, and integrative and imaginative. We have something at ASU called the Center for Science and the Imagination, and that's going to play a role. And again, the industry focus. So we are hoping in our buildings downtown, in our building downtown, to co-locate some health-focused companies right in the building or very closely nearby at the Wexford building. Similar timeline, only this one started maybe, I don't know, maybe a little bit earlier, and we hope to be enrolling students this fall. This school as well, we've identified and hired a dean. His name is Jay Pathak, and now this fellow, I don't think you'll remember Dr. Litton, but he was also at Mayo for a time. He's a bioinformatics expert, and he's currently in the School of Public Health at Columbia. We have some other components within ASU Health. The Medical Masters Institute is basically a compilation of all of the master's degrees across the entire university that have a focus in health, put all in one place, plus some new ones that we're creating. I've mentioned the Edson School of Nursing and Advanced Health Innovation. The focus at the School of Nursing is, frankly, to produce more nurses, but also to do more with technology. So one of the things that they are working on right now, for example, is collaborating with a company that we're working with to try to build an agentic AI nurse, so an AI agent that can really extend the nurse's ability to take care of more patients without burning out the nurse. And so we're in the process of piloting agentic AI in nursing under the supervision of a nurse with that school. The College of Health Solutions, also a component of ASU Health. Some of you may know people who are in that college. So there are a number of different professions in that college, speech and language pathology, a number of other disciplines, and also bioinformatics, biostatistics, epi, those sorts of skills. Can't have a health initiative without health research. There's a lot going on in health research and biomedical research at ASU already. And we focused it in these three big areas. So mind-brain health, metabolic health, and environmental health, with a number of focus areas within that. But those are the three big ones. And all of this leveraging technology, AI, and engineering. Oops. Maybe I need to. This and the next slide are maybe a little bit difficult to explain unless you already know about them. But we have something called the Health Observatory at ASU. It's basically a repository of health data about the population in the valley, population data in the valley. And that, so think wastewater surveillance data. That's where the wastewater surveillance data was managed and held. And it's able to, this resource is able to identify problems in the population, in the community that we might have difficulty otherwise identifying. And that could be the next pandemic. It could be a pocket of fentanyl overuse in a particular area of the population that we didn't already know. So its goal is really to transform health data into knowledge, actionable knowledge. And then something called the Decision Theater at ASU takes all of that data. It's really the analytic and data visualization arm of the observatory. So you can visualize the data in creative ways, analyze the data in creative ways. And this is used actually for public policy for city and state agencies to make decisions. And so I happened to be in Mayor Gallego's office not so long ago, and we were talking about all these things. And somebody asked me, well, tell me about the Decision Theater. And she cut me off and says, well, let me tell you guys how I've used it. This is the mayor talking. And so it's an opportunity It's available publicly. So if a state agency or health system, I think Banner is looking at using it, has a complex decision to make. Could be about placement of a hospital. It could be about predicting nursing staffing needs. So a complex decision like that with many, many inputs, you can bring it to this center and be able to not only analyze, but interrogate the data in real time using sensitivity analyses and other things. And that should guide more better informed decision making. So, you know, what if this variable was twice as high as I predicted or 3 times as low? What would that do? How about changing these 4 at the same time? That kind of thing. So complex. Health literacy. So the other side of health information is how we use all of this information that we're gathering about the health of the population and make it accessible for individuals and families to make better decisions on their own about their own health. And that's the health literacy goal. I mentioned this, I think, a little bit earlier, ASU clinics. It's at this stage, still just at the vision stage, but the idea is to build a series of clinics, physical, mobile, virtual, led by our nursing college to provide access in areas where access doesn't currently exist. And so, you know, there are multiple models of these in the country. Where I was most recently at Rush University, we had a clinics network run by our nursing college, you know, for 3 decades that's been successful. And there are others around the country. And so that's the idea there. But again, we're planning to integrate innovation and technology into these clinics in ways that hasn't existed in the past. The last bit I'll talk about, I know it's a lot, the last bit I'll talk about is our focus on innovation, entrepreneurship, and partnership. So when I joined as EVP for ASU Health, this was my first hire, which is, you know, you'd think is a bit unusual, right? If you're trying to build a health enterprise and the first person you hire is leading the business side. But it's very important to us. And it has 4 components: this Health Venture Studio, what can we do to optimize student experiences, strategic partnerships, and commercialization. The Venture Studio is basically a capability that invites startups, new companies to come in and then uses the university resources to support them to develop their idea into something that could lead to commercialization. And we hope to launch that in fall of 25. Creating value for good is a focus of ours. If you haven't been there, this is our SkySong Innovations, which is one of the innovation zones at ASU. And again, the idea is to invite more health-focused companies to come to this facility where they receive lots of wraparound services to help them stand up their innovation and put students right in the mix of all of this. Training. So I spoke a little bit about the immersive learning experiences, using avatars and other cool technology things in our medical school and in our public health school. Well, what can we do to work with others to sort of scale these ideas? So this is an initiative that's focused on how do we share those opportunities? So there are a number of schools of medicine, for example, that are interested in our curriculum. Are there ways we can share those to benefit both institutions? And then just a little bit about our partnerships. I put Creighton in there because I consider you guys a partner, but we partner with all of the health systems in the region. Obviously, our primary clinical partner is Honor Health for the medical school, but we have strategic partnerships with every other one. And this is just a selection of some of the other partnerships we have within the ASU Health ecosystem. Innovation zones. ASU has all of these sites around the valley, each with a different focus on innovation. And ASU Health is leveraging virtually all of these for something in our health space. So again, it's trying to leverage everything the university has to offer in order to advance health. Mentioned Honor Health is a primary clinical affiliate for the medical school. They're, of course, a community-based health system, which aligns very well with our mission. And they are unusual because they're a community-based health system that also is highly innovative and has a clinical research enterprise that's thriving. So we're very excited about that relationship. Right now, it's focused on the medical school, but we're talking to them about what can we do together in nursing, and what can we do together in innovation, predictive analytics, and so on. Having said that, ASU and Mayo have had a relationship for a very long time, since I was dean, I don't know, of Mayo Medical School, maybe 12, 13 years ago, and that's just continued to grow. And that's called the Mayo Clinic and ASU Alliance for Healthcare. We have some shared spaces, as you can see pictured there, and that's only growing through ASU Health. I think this is like my next to last slide or something like that. So this is a big, bold, multifaceted initiative. And when our president is asked about it, he says, yeah, it is a big, bold, multifaceted trans-university initiative, but we know how to do this. We've done this before. And one of the reasons that I'm very confident that we're going to succeed is that we have a champion right at the very top. So that is all I had. You can actually read my email on this one, and I'm happy to answer questions. I never go right to the end of my allotted time. I love to leave time for questions. So. Thank you.
That was perfect, Dr. Gabriel. Thank you so much for sharing with us your wisdom, your insight, your experience earlier, and also just sharing this huge vision and just very transformative approach to medical school and healthcare. So we're going to take a few questions. We'll make sure you get out on time. Go ahead. We'll also have the Zoom folks.
Yeah. Oh. Yeah.
Social determinants of health and all those things are such a major player in health outcomes. How do you envision that interfacing with sort of the health policy or advocacy or all of those other policy level things that have such an impact on health?
This is just for the audience.
Oh. Should I repeat the question? Okay. I guess the question is
just the short version. If you could repeat it.
How do you envision sort of an interface with policy level, even legislative, those kinds of things, interacting with this, since we know that has such an impact on health?
So you're absolutely right. It does. And this is central, right? And so I'll just give you a couple of examples. So one of the things we did early in the development of ASU Health, and also in the development of the School of Public Health in particular, was have what we called listening sessions with a variety of segments of the population, from tribal populations to, Hispanic populations. I mean, I think there were maybe 10 different groups, each representing a different segment of the population, because the first lesson I think I learned in order to make a difference in those areas is to listen. Right? To listen to where the pain points are, especially as you're designing something new, will help us better understand what the real challenges are in health. And then we can take that and figure out as we're building a school of public health that has, for example, that it works with the public health departments. What can we incorporate into our design that speaks to those? And and that was it was a first step, not the only step. So it's not like, okay, tell us how things are going and what you need, and then we go off and never talk to you again. So it was the first step to building kind of ongoing relationships. And I think that's the only way to do it, is to, yes, engage our health policy leaders, which we're doing with the legal department and with others at ASU that have done that sort of work and research forever. But it's engaging with the populations themselves to understand what the problems are, what the pain points are today, and then incorporate that into our design as best as we can. And then, you know, touch base again and again to see if we're hitting the mark. So it's an iterative process, but you're absolutely right. That's key.
There's a couple related questions on the chat. Are the tribes sharing data, and will you have mobile clinics in Mojave County?
Are the tribes sharing data?
Where the data points that you put up there, you said that people could go in and try to find different data points. Are tribes sharing data with you?
So the points there were from, we're not Mayo. I'm sorry, we're not ASU. They were from the Commonwealth Fund, and I believe that the answer to that is yes. And it's also yes, that we've had relationships with tribal populations in the past where data has been shared, where there's been joint collaborative work going forward. And so we hope to build on and strengthen those relationships. And, you know, without data, we really don't know where we are. So it's absolutely essential. And there was a second part of that question that I've forgotten now.
The clinics you were talking about, the ASU clinics, are they going to go into Mojave County?
That's the vision at the moment. Yes, they are still, as I said, in the design phase. Yeah.
One question over here.
Oh.
Hi, Dr. Gabriel. Thank you so much.
Hi.
Question from a lifelong technology enthusiast who loves AI and loves collaborating on a number of spaces with ASU. You know, as we see some of the technological conversations that have scaled rapidly in the last generation play out in ways that kind of had unintended consequences, right? We're so technologically connected, and yet as a society, we're so disconnected due to a variety of sort of sociocultural factors. You know, in a grand sweeping vision that is so heavily tech-focused, AI-focused, engineer-focused, do you think about the counter discussions of we can do a lot of things, which ones should we do, and what may be the unintended consequences for the health outcomes we're seeking?
Yeah, so the short answer is yes, all the time, right? And so the relationships that I talked about with the companies that are building large language models, whether it's OpenAI or, you know, the other 10, I think, that we're working on, the approach has always been, what can we do to bring the technology in-house and then put boundaries around it? And so some of the problems that you see, and you might know more about this than I do, are when you let the technology go into the sort of the entire world and things come in like hallucinations or whatever that could mislead you. We try to create bounded examples that have, so that we know we set the boundaries for where the large language model goes out to look. And they're still very broad, but it's not absolutely everything. We do things like identify references so we know where all the data came from. And so that's the advantage of building a collaboration with a company rather than just saying, we're going to use OpenAI, or we're going to use Gemini, or we're going to use whatever. We build a relationship and then try to put some governors around it, not to eliminate, but to try to minimize that, and then work with the company to continually study those issues, and again, try to do what we can to mitigate those risks. Having said that, I think this, I mean, I'm obviously all in here, but I think the solution is not, well, we can't go there because there are some scary risks. I think the world is going there. And so the solution is, how can we do it in a responsible way? We're continually studying what we do and how we do it, and putting some responsible boundaries around it. It's the best we can do, but we'd love to have you help us.
Excellent. A couple more questions. I think you had your hand raised earlier, and then you.
Thank you so much, Dr. Gabriel. One of the questions that I have been wondering about with, of course, Creighton being a relatively recent entry into the physician training world as a medical school, which, was shortly preceded by ASU's Phoenix campus, or I mean, U of A's Phoenix campus, and now ASU bringing in that. There's a lot of health professions like nursing and physician assistants and some of the other disciplines where their training is sort of, once they're done, they're out in the workforce. With physicians, which is kind of our audience and stuff, as I know it's a little bit different in that, even when you graduate medical school, there's a whole still another level of training and thing that still has to take place. And, I've always kind of seen that you can have as many med students and things as you want, but if you're really trying to improve the health outcomes and the access to patients, really the step is kind of the graduate education, because that's where you build your networks. That's where people are most likely to work, settle down and things like that. And so, I think part of the solution to improve the outcomes is also kind of taking a look at that. So I just wanted to comment, bringing in the med school to do that, kind of what the thoughts are and kind of plans are to kind of help to retain some of those students as Arizona or community physicians. And
yeah, and so you're exactly right. Of course, the data is pretty clear that people, once they become residents, where you go to residency is a much better predictor of where you're going to stay than where you went to medical school. And as part of our relationship, our collaboration, or agreement with Honor Health, we have a whole section on GME. And after 2 years after the school opens, the GME programs, and they have quite a number, I want to say 16, 17, and they're growing them all the time, will transition to ASU as the sponsoring institution. So we will manage those GME programs. And that's exactly why, because that's so important to predicting who stays, and we hope that will help us encourage that.
Perfect. One more question.
Oh, I was curious about the kind of focus on the engineering specifically, because it's like even the school has engineering in the name. You mentioned some aspects of that might be changing at some point. Just kind of because it seems like part of the goal of this and part of ASU's capability is having it be really radically interdisciplinary. I was just curious about the focus on the interdisciplinarity being in engineering versus in all the other fields, essentially.
Well, it's not really versus. It may be the first of equals or something like that. And when I said the name's going to change, we think we have a naming gift, so that's where the name's going to change, but the focus on engineering won't change. And let me just give you maybe a couple of examples of the integration. And before I do that, I'll say we're not in the business of training engineers. So these aren't going to be chemical engineers or civil engineers or anything. It's about bringing engineering principles to the study and understanding of medicine. So in the integration, I'll give you an example of how we're integrating it. So as we're learning about the cardiovascular system, at the same time, we learn about, flow dynamics and engineering principles that pertain to the cardiovascular system. We learn about, the squiggles on the ECG, how are those actually produced? What are the principles behind that? And students that come out of this medical school will actually have 2 degrees. They'll have an MD, obviously, and a master's in medical engineering. So it's more of an engineering principles kind of general engineering degree rather than training a civil engineer or a chemical engineer. So I don't know. I hope I answered your question there. Was there another piece? Looking at you, I'm not sure I answered it fully, actually.
Very deliberate deliberate focus
Yeah.
area. You know, like I'm a psychiatrist, right?
Yeah.
So there's elements of engineering that are very relevant to psychiatry. There's also elements of many other professions that are relevant to that. So I was thinking,
And so our
yeah.
dean is a psychiatrist, and her research, as you may know, is about neuromodulation. And so that's very close to the engineering world. That's why she brings that. But whereas engineering is maybe the first of the integrated disciplines, we're also, for example, integrating humanities in a way that hasn't been done before. So we're creating a Center for Health Humanities. And as I mentioned maybe earlier, that's run by a professor of English who has led this Center for Health Humanities ideas in that world and done research in that world and written a book, I think, for a decade. So we're integrating other disciplines, but you're right, engineering is sort of primary. There are 2 other medical schools in the country that have done that. We think we're doing it in a more creative way, but one is in Texas, Texas A&M. They have a branch of their medical school that brings together engineering and medicine very explicitly. And we're working closely with them. And then the Carl School in Illinois does that as well.
Very cool. Thank you.
All right. Thank you so much, Dr. Gabriel. And we'll just wrap it up. We are very grateful for your time, for your generosity, and for really sharing your experience, your wisdom, and your vision with us. Thank you. A big round of applause.
Thank you all very much for your attention.